Welcome to Thursday's edition of COVID-19. Korea has recorded yet another day of cases in the 400s. Accordingly, authorities are urging members of the public to refrain from social gatherings that could raise their risk of infection. I have Kwon So standing by with more on the pandemic situation here in the country and elsewhere around the world. So do start us off with the domestic updates.
Right, Sunny. For the second straight day, Korea reported over 400 new coronavirus cases. 451 is the number we're seeing here as of 12 a.m. And that is a slight decline from Wednesday, but not a big difference in domestically transmitted infections. Here still at above 400, 429 to be exact. And with that, the total number of cases stands at 79,762, and the country added 7 new deaths, raising the death toll to 1,448. Now, as the daily figures are not showing signs of improvement, as you can see here, with a week left until the Lunar New Year holiday, authorities are still cautious on the earlier suggested possibility of partially easing social distancing measures if we see a clear downward trend. But cluster infections linked to hospitals, places of worship, and day-to-day venues are still popping up, including here in the capital, Seoul, which reported 172 new cases, followed by 134 in Gyeonggi-do province and 44 in Incheon, and also some double-digit figures in Chungcheongnam-do province, Gwangju, and also down there in Busan. And out of the 22 imported cases that the country reported today, 6 were detected at the nation's airport or seaports, while the others were confirmed during the self-isolation period.
Right, Swana. Speaking of those cases, I hear we have our first community spread of coronavirus variants from the UK and from South Africa.
That's right, Sunny. And that is also why officials are warning that this development could even lead to a 4th wave of the coronavirus here by March. 5 cases of COVID-19 variants were confirmed, 4 from the UK and 1 from South Africa. They all were transmitted domestically and during the mandatory self-isolation period for inbound travelers. Now, there have been earlier cases when that happened, when those arriving in Korea stayed with their family members and tested positive during the 14-day incubation period. But what's happened this time is that of a total of 4 relatives contracted the UK variant from a person that flew in from the United Arab Emirates late December. Over 30 other infections linked to that cluster are being tested for the variant, meaning there is a chance for the number to further rise, and why authorities are calling on efforts to stem the situation before it escalates.
It appears that a foreign national who entered Korea from abroad came into contact with others while in self-isolation. Our most urgent task is to preemptively stop a widespread community outbreak, especially considering the highly contagious nature of the new COVID-19 variant.
Now, variants are no longer just a threat to South Africa, Brazil, and the UK, as we see that other countries are actually seeing more rising figures than in those countries. For instance, the UK here, and now the daily infections here have dropped to below 20,000, as the UK reported some 19,000 new infections in the past day. But France here had some 26,000 new infections affected by the UK variant. In the meantime, the Czech Republic here has become the 20th country around the world that has hit over 1 million cases in total. And the total number of infections around the globe stands at 104.9 million, with over 500,000 infections reported in the span of 24 hours. And we also have some 15,000 new fatalities. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for now. Right, for a broader coverage of the domestic COVID-19 situation, I have our Kim Ji-yeon here in the studio. Welcome, Ji-yeon.
Hello.
Right, then let's start with the mock drills to simulate the transit of vaccines upon their arrival at the airport.
Sure. Korea conducted a 3-day drill this week aimed at the quick and safe transportation, storage, and distribution of coronavirus vaccines, with the country's vaccination program set to begin later this month. The drill was a joint effort between the military police, the Transport Ministry, the Korea Disease Control and Prevention Agency, and the Korea Customs Service. President Moon Jae-in inspected the drill on its last day on Wednesday at Korean Air's cargo terminal at Incheon International Airport. Take a listen.
오늘 이게 보고를 들어보니 이렇게 화이자 백신이 당장 들어온다 하더라도 요 수송 보관 유통 이 계획에 좀 빈틈없이 잘 되어 있는 것 같은데 이제 그 부분이 정말로 좀 차질 없이 시행될 수 있도록 모의 훈련을 좀 철저히 해주시고 그래서 실제 이제 화이자 백신이 들어오고 난 이후에도 이 백신의 수송, 보관, 유통 전 과정에 국민들께서 염려하는 일이 전혀 없도록 그렇게 좀 대비를 잘 해주시기 바랍니다.
The first vaccines will be Pfizer doses set to arrive later this month, which must be stored at below minus 70 degrees Celsius. From the airport, they'll be moved to a logistics center in Pyeongtaek in Gyeonggi Province and then delivered to the National Medical Center in Seoul. And during transit, the military, the police will escort the refrigerated trucks in case of any emergencies en route. The vehicles transporting the vaccines will be monitored in real time to track their location and temperature as they head to hospitals and vaccination centers nationwide.
I see. Meanwhile, Chen, I hear we confirmed our first case of COVID-19 among service members stationed overseas.
Yes, Seoul's defense ministry said Wednesday that 2 Army officers on a peacekeeping mission in Lebanon and 1 Navy officer dispatched in Bahrain have tested positive for the coronavirus. The 2 officers who are part of the UN interim force in Lebanon were confirmed after a cafeteria worker on base tested positive the previous day. The Navy officer was confirmed after a foreign officer on the same base tested positive last Saturday. The 3 Korean service members are currently receiving treatment near their bases and reportedly experiencing mild symptoms. Meanwhile, the Korean military has extended its level 2.5 social distancing measures, the second highest in its 5-tier system, for another 2 weeks until February 14th. Under the measures which were adopted since the end of November last year, taking leaves and venturing off base are banned, but a new exception has been made for cadets who haven't taken a single day of leave since joining the military. As of Thursday morning, the military has reported 553 coronavirus cases in Korea so far, with 10 of them still receiving treatment.
I see. One final question before you go, Cheon. What's the latest with regard to our inoculation campaign and efforts on the treatment front?
Well, first off, in regards to foreign vaccine, the KDCA said it had requested the Ministry of Food and Drug Safety to apply a special fast-track import system for the Pfizer vaccines. The country plans to bring enough doses to inoculate 60,000 people this month through the COVAX facility's Global Vaccine Provision Program. Meanwhile, the drug regulator is holding an advisory panel review on Friday to decide whether to approve the COVID-19 antibody therapy Recirona developed by local pharmaceutical giant Celltrion. If approved, it will become Korea's first locally made coronavirus treatment. Celltrion has already wrapped phase 1 and 2 clinical trials. The phase 2 study was conducted on 327 patients with mild to moderate symptoms. The agency said earlier this week that its panel had recommended granting conditional approval provided that the drug maker submits data from its ongoing phase 3 clinical trial. But experts seem to be divided on how the treatment should be used, with some saying it should be reserved for patients in the high-risk category only, while others argue that they should be also administered to low-risk population groups.
All right, Cheon, as always, thank you very much for that report. Hope to see you again soon.
Thank you for having me.
Right, it's time now for the regular briefing on COVID-19 here in Korea for this Thursday. Social restrictions on gatherings remain intact until the 14th of this month. Now, authorities later this week may address the possibility of some ease in restrictions ahead of next week's Lunar New Year holiday. But as our Kwon-Soo mentioned earlier, given the recent rise in daily cases, such prospects remain uncertain. In the meantime, social gatherings of 5 or more people indoors and outdoors across the country are banned. Violations can result in fines of up to 100,000 won. I understand the briefing is about to start. We'll come back to you afterwards.
First of all, we have Mr. Kwon Junuk with the explanation on the briefing. Let us now begin our regular briefing for February 4th, Thursday. As of today midnight, we have 429 new local infections and 22 new imported cases. The total caseload now stands at 79,762. Yesterday, we had over 74,000 tests conducted on a daily basis, and also in the metropolitan area's makeshift testing centers, we carried out 27,763 cases, and out of which 85 people have tested positive. And we also have 405 more people making full recovery, and we have 8,610 people remaining in quarantine. There are 211 patients with critical or severe conditions. We had 7 additional fatalities. And I extend my deepest condolences to the deceased and the members of the bereaved families. First of all, let us go over the updates on our domestic cases as of midnight today. And overall, in the metropolitan area, we have over 78% of the total cases breaking out. And in the metropolitan area, especially in the Seoul's Gwanak-gu district, we have 17 people identified in a health care facility. And also, University Hospital in the Seongdong-gu district, we have 69 total patients. And also in Gwangjin-gu City at a restaurant, we have 51 total cases. And a welfare facility in Junggu district, a total of 76 people have been confirmed. And also in Gositel in Dongdaemun-gu district, we also have additional cases being confirmed as well. And in the metropolitan area in Gyeonggi-do province in Suwon city, we have 55 cases breaking out at the welfare facility, and 24 at a daycare center in Namyangju city, and also Incheon Junggu city. In relation to an taxation company, we have 18 confirmed cases, and also at a trading company in Yeonsu-gu district, we have 15 total cases of COVID-19 being detected. And in Chungcheong area, in relation to distribution business in Dangjin, we have a total of 39 people, and 15 people have been identified at the meat processing factory in Chungbuk area, and also a total of 42 at a religious facility as well. And in Daegu, in Bukgu district, in relation to an office, we have 24 additional patients being confirmed. And in Gyeongnam area, in Kumjeon-gu district in Busan, we also have 92 cases at a nursing hospital. And in Seogu district of Busan, we have 47 cases of COVID-19 detected at the Port Transportation Union. And we have some updates on our analysis of the antibody survey. And last year, we have carried out a public survey on the antibodies that have developed among the Korean citizens. And first of all, in the nationwide, we have carried out the public nutrient survey, and we have carried out antibody testings of over 52,200 people, and 5 people have tested positive. And also, we also tested the new cadets enlisted at the military army, and we have carried out more than 9,000 testings, and we have confirmed 31 people had tested positive for the antibodies. And also in Daegu and Gyeongsan area, we carried out also an analysis on about 2,400 residents, and also another 1,000 people of the medical people, and we also carried out 19 people that have showed these antibodies. And based on this result, we also see that in relation to the antibodies developed among the Korean citizens, we have been consulting with the experts, and compared to other countries in overall, the antibody rates developed among our people is lower than other countries. And compared to other countries, we believe that this shows that our public has participated well in our quarantine measures. However, among those people who have developed antibodies, they also have could have infected the virus, meaning that there could also be unidentified positive cases of COVID-19 within our local community. However, the analysis, the test that has been conducted did not reflect the people after the third wave of the COVID-19 here in South Korea, and therefore there are limitations in as of the interpretation of such findings. And going forward, we will continue such similar testings for new cadets who are enlisted in the military, and also we will be also carrying out testings for 5,000 people who have tested positive for the COVID-19 virus. And moreover, the KCDA, along with the government's monitoring of the COVID-19 new variants stemming from the UK and South Africa, we are trying to cultivate such samples. And in order to have the qualifications for such culturing of these virus, we need to also have qualified laboratories, and they need to be qualified for the level 3 grade. And also, moreover, all of these tests that are conducted, there could be different standards of the biodiversity criteria. And going forward, we will be carrying out further analysis of the new variants of the UK and South Africa variants, and we will also make use of these new studies to develop new COVID-19 vaccines as well as new therapies. And moreover, as for the new variants, and we have carried out some analysis on the period of the antibodies, and here are some details. And among the COVID-19 patients, people have donated their blood plasma samples. We collected 100 people as samples, and we are seeing how long the persistence of the neutralization antibody persists. And among the people to be vaccinated, we will be also monitoring this, dividing the group into doctors and medical staff members and regular citizens, and we will also conduct a future analysis going forward. And at the same time, we will also, as mentioned earlier, among the UK and South Africa variants that we have the virus cultivating here in South Korea, we will see the analysis of the effectiveness of our treatment and vaccines against such new variants. And we believe that these interim results will be unveiled sometime next week. And in the long-term period, we will also carry out continued testings and assessment of the effectiveness of our therapeutics and vaccines. And we believe that they could be utilized for scientific evidence and proof going forward. And here in South Korea, as for the remdesivir, the treatment, we have administered the drug to over 4,100 people at about 118 hospitals nationwide. And we'll believe that the antibody treatment will also be rolled out, and we will be carrying out the third clinical trial as well upon the approval by the Ministry of Food and Drug Safety. And we also have approval by the Ministry for uses of such treatment for the treatment for inoculations. And here are some life quarantine measures that we would like to highlight. We are seeing a downward trend of the COVID-19. However, we have the mass inoculation of the COVID-19 vaccines in schedule, and also we have the opening of our school year very soon. And we ask the public for the following 3 areas. First, please refrain from having social gatherings, and also stay home safely, and also switch all of your face-to-face meetings to non-face-to-face means as well. And also, regardless of where you are, please wear your face masks. If you are indoors, please wear your face mask at all times. And also, do not make any environments where you need to take off your masks, like smoking or consuming food and beverage. And last but not least, if you have any suspected symptoms, please get tested as soon as possible. Last but not least, I would like to highlight the following. The COVID-19 in relation to this virus. Here in South Korea, our daily cases hover at around 400. And we are also seeing a decline in the number of critically and severe people with severe conditions, and also a lower number of total new death toll, that is. However, we believe that this downtrend could also persist for a very long time. And during this downward trend, we could see a very small rebound in the number of COVID-19 patients. We believe that such a trend were possible thanks to the public's participation in enduring the difficulties and inconveniences that have been resulted from the gathering ban on 5 or more people. And also they have also complied very well to some gathering ban as well. However, we still have many risks of the COVID-19 infection. We are seeing an increase of foot traffic and movement, and we also see a climbing of the reproductive rate of the COVID-19 as well. And we also have many medical hospitals as well as large university hospitals that are witnessing cluster infections. And also at places of worship and detention centers as well as large-scale office spaces, we are seeing a repetition of such cluster infections. And we also have the high possibility of new variants coming into South Korea as well. And we are on the verge of a possible massive outbreak as well. Maybe the COVID-19 is also targeting all of the weak areas of our society of South Korea. I also want to highlight the fact that we need to always wear face mask regardless of where you are. And this is a very crucial. And however, as a quarantine official, I have a small hope. According to the weekly analysis of the WHO, according to their statistics, for the 3 weeks, during the past 3 weeks, we are seeing a very clear downtrend in the COVID-19 outbreak. We need to see and analyze the detailed reasons behind such downward trend. However, before our vaccines have full effect, we believe that we are able to contain the virus to a large extent. Moreover, here in South Korea, we will be beginning our massive inoculation of the COVID-19 vaccine starting from this month. And we are also entering spring as well, which is a season that is very helpful in carrying out our social distancing measures. However, we cannot stay complacent because we could also have many environments which could also higher the risk of COVID-19 infection. However, the government will also exert our full efforts to this end. Thank you very much.
Right, there was Kwon Junuk with Thursday's afternoon briefing. So what did he have to say?
Well, we do have a number of new cluster infections that remain a risk factor to the nation, as well as the COVID-19 variants from abroad. And on that, Kwon said that there's analyses being in process here in Korea on these variants from the UK and South Africa, and also on how these domestically made treatments are going to work on these variants as well. He also mentioned that we are seeing some signs of a downward trend domestically as well as around the globe, citing the WHO, saying that in the past 3-week assessment, numbers are going down, but more analysis is needed, and also especially vaccination has to process further until then we have to abide by social distancing measures. With that, he also stressed again that masks should be worn even if you're with your close family members, and that especially as we are ahead of the vaccination program to kick off soon, as well as the new school year.
Right, so as always, thank you for that. I'll see you again tomorrow.
See you tomorrow.
Now, as mentioned during my talk with Chian earlier on in the program, maintaining the cold chain is of utmost importance in ensuring the potency and efficacy of COVID-19 vaccines. In this next report, we visit a factory that's working around the clock to keep the cold chain intact. Do take a look.
정부는 코로나19로 인한 사망자를 최소화하고 지역사회 전파 차단을 위해 11월까지 집단 면역 형성을 목표로 하는 코로나19 예방접종을 2월부터 차례대로 시행할 계획입니다.
Hello everyone, this is Shin Se-byuk. The COVID-19 vaccine rollout is just around the corner. The South Korean government has secured vaccines from 5 suppliers, and these vaccines have different storage requirements in terms of temperatures. So some vaccines, they need to be kept under extremely cold conditions. So having an ultra-cold freezer is a must. So today we're going to look around a freezer factory and see how freezers are made using what technologies. We'll also find out how vaccines will be stored. The government plans to set up 2 ways to store COVID-19 vaccines to ensure that they are kept at the right temperatures. Vaccines made by AstraZeneca, Janssen, and Novavax can be stored and transported at normal refrigerated temperatures. Meanwhile, Pfizer's and Moderna's vaccines need to be kept extremely cold. So the government said it would operate separate inoculation centers for Pfizer and Moderna vaccines. So this factory produces ultra-low temperature freezers because, as I mentioned, some vaccines such as Pfizer's and Moderna's require ultra-cold conditions. And this is the freezer that can maintain temperatures of between minus 60 to 90 degrees Celsius. So what is the science behind it?
소전냉동고는 이중 특수한 열교환 시스템으로 구성되어 주로 백신을 보관하는 데 그 목적이 있습니다. 특히 이제 장기 보존을 하는 경우에 초전냉동고를 많이 활용하고 있습니다.
According to official data, vaccines made by Pfizer have to be stored at minus 60 to 90 degrees Celsius, while those by Moderna should be kept at minus 10 to 25 degrees Celsius. Keeping coronavirus vaccines at sub-zero temperatures during distribution is hard. So the company has prepared its freezers ready to go anytime when orders issued.
그러면 여기 안에 지금 백신이 총 몇 개 정도 들어갔어요?
약 20만 도즈 정도 지금 되니까요.
How long can vaccines be stored inside the freezer?
사용 시까지 무제한적으로 영구히 보존할 수 있는 부분이고요. 지금 현재 그 화이자 같은 경우는 우선적으로 지금 공지된 부분은 6개월까지로 지금 보고 있습니다.
South Korea will kick off its vaccination program in few weeks, and that makes the factory operate around the clock. The company's ultra-low temperature freezers are made with the help of cutting-edge science and technology. The freezer has 2 separate cooling structures, so even if one fails, the other one still works, which enables the freezer to maintain temperatures of minus 70 to 90 degrees Celsius.
월 300대 이상 계속적으로 꾸준히 생산 계획을 가져가고 있는 상태입니다. 백신 냉동고 그 공급을 위해서 계속적인 공급에 만전을 기하도록 하겠습니다.
Finally, COVID-19 vaccines will arrive in South Korea, and we are about to have our daily life back. And to do so, we have to have a thorough preparation before the vaccination program starts. This has been Shin Se-byuk.
고용안전망의 사각지대에 있는 특수형태 근로종사자 및 프리랜서, 소상공인 등의 고통이 어느 때보다 큰 상황입니다.
코로나를 겪으면서 보건, 돌봄, 운송, 환경미화, 콜센터 종사자와 같이 우리의 일상 유지를 위해 없어서는 안 될 필수적인 역할을 하는 분들의 노고를 새롭게 깨닫게 되었습니다.
While prospects this year for the labour market are looking obscure as social restrictions look to remain in place for the months ahead, the burden on essential workers is looking to grow. Now, we take a look at this reality today with Professor Cho Hee-kyung from Hongik University. Pleasure to see you again, Professor Cho.
Hello, good afternoon.
And I also have Professor Lee Seung-yoon from Chungang University. Welcome to the show, Professor Lee.
Hello, thank you for inviting me.
Right, Professor Lee, we'll start with you then. What has been the impact of the pandemic on the labour market?
Well, the impact is very disastrous. The ILO reported that the negative impact on the labor market and the economy is serious. It has never been so serious after the World War II. So since the history after the World War II, this is the most serious impact. If we focus a little bit more on Korean situation, there hasn't been a serious lockdown, but still we see a lot of negative signs in the labor market. According to the statistics on last year, 2020 December, we had the third wave of increase of this infection, the pandemic, and the number of employed decreased by 628,000 people compared to the same months last year. And the features here that is more worrisome is that this kind of negative impact was given differently, and it also affected the inequality rate in Korea. According to my own studies regarding the labor market effect, the temporary workers faced 7 times higher dismissal during last year compared to the regular workers, while only half of them compared to the regular workers were actually receiving the unemployment insurance. So there were people who were more exposed to the labor market risk, but they were excluded actually from the social protection. So there are this kind of negative impact overall, but also at the same time inequality increasing throughout this disaster, I would say.
Right. Professor Cho, as Professor Lee has mentioned, the pandemic has been particularly brutal on gig workers, including those in freelancing, temporary working arrangements, and subcontracted employment, I believe. Could you tell us a bit more about their plight?
Right. So the categories of workers that you've mentioned, the gig workers, the freelancers, the temporary employees, subcontractors, and what they call specially employed workers, what they all have in common is the fact that they are typically not entitled to the benefits and protections given by the labor standards law in Korea, because they are not categorized or classified as an employee under that act. So although they are actually in most need of those protections, they have been excluded. And as Professor Lee mentioned, what pandemic has done, I believe, is not just sort of bring the problems to surface, but amplified the existing problems that are already endemic in our society. And it's acting as a magnifying glass, and it's really increased the gap between the standard workers who enjoy the benefits under the labor law and those who have been excluded from it.
Right. A very common term, Professor Cho, nowadays amid the pandemic is the term essential worker.
Right.
Could we start first with perhaps a short definition of the term essential worker?
That would be almost $1 million question. So essential workers, I mean, we call them essential workers. In other countries, they're also known as frontline workers or key workers. And basically, those are the workers who are having to do their normal job despite the fact that it's actually brought increased health risk to them, because they are essential to the functioning of a society and for us to keep going. So they would include health care workers. They would include those people who do deliveries of our groceries, our meals, and all our everyday consumer products. Those people who provide care for the elderly, the sanitation workers. What would we do if our garbage wasn't collected each week and so on. So it's actually a little bit difficult to categorize because would you include then all the teachers in that essential worker category? And so I would say no one has been able to come up with a sort of capsule definition of what an essential worker is, and that's actually a space where there is a lot of debate going on about who should we classify as essential worker. But I would say that if we have people who are having to do their job, continue to turn up to their workplace despite the pandemic, despite having this increased risk, and are not able to make alternative arrangements, I think they have to fall within the essential worker category.
I see. And are these essential workers being treated like they're essential, do you think?
That is the crux of the debate, I think. Just in the brief introduction, we saw President Moon talking about how we have come to appreciate the value of these workers in our society. And we know that they carry out these essential tasks, but I think up until now, we have really undervalued the contribution that they make to our society. And we have had a tendency to look down upon what they do. Not a day goes by when I read the news and there is a story about how a delivery worker has been ill-treated, abused, insulted, and so forth. And we've had a sort of a culture where we tended to look down on people who work with their hands, people who are sort of tradespeople, and we really need to look at and reappreciate their value to us.
That's true. We've taken them for granted for a very long time. Professor Lee, I understand you conducted research on the working environment of essential workers. What can you share with us?
Sure. Let me add a little bit more on what Professor Jo mentioned and explained about the definitions of essential workers. As Professor Jo said, there's no clear ultimate definition yet. Internationally, the OECD also suggested a definition. The ILO also, labor organization, suggested, the European Union also. And also in Korea, the related law is being prepared at the moment. We need a law to define the essential workers first, and then categorize, and then support. So it's undergoing and being prepared at the moment. But one common features that I would find would be those workers who have to physically appear on the workplace. So this is more of an inevitability of the face-to-face work. This is one very clear characteristics of the essential worker. The second aspect is basic service. Those who are contributing or participating in the activities of delivering or producing basic service and products that are very necessary or essential for the basic livelihood of the society and the community of the people. So these are some of the definitions around the essential workers. I guess those organizations or scholars who say essential workers emphasize more on the inevitability of the face-to-face work, and those inevitability of the necessary service and products, occupation area of such, and those definition terms such as frontline workers are those who emphasize more on the face-to-face, immediate face-to-face interaction related work. According to my recent research on the essential workers that I've done in a district in Seoul, the common characteristics of these people, as Professor Jo mentioned, is that they have already, before the COVID-19 pandemic, the already existing characteristics was low pay, high labor intensity, and also emotional stress was highly related because it was a more face-to-face, interpersonal service job. So, and then the general working condition was not really good. The employment relations was more precarious, and majority of them were also excluded from the social protection that is geared toward the so-called standard employment relationship. So these were the characteristics, some precariousness we found before even the COVID-19. So as Professor Jo said, they were undervalued and working was a quite precarious working condition. Now, after COVID-19, these aspects has been all intensified. So with the health risk, they still have to appear physically to the workplace, and some of them actually had a risk of infection, but they still and had a fear of being infected, but still had to appear in the physically appear in the working place, because it's not possible to do a remote working like the white-collar desk job, like for example me, I did an online teaching. It wasn't possible for them. So they needed some health-related prevention system publicly. Some of them actually experienced a intensification of a workload, like this was found in the delivery workers because it expanded very much. And so very unfortunate, almost every month last year, we had at least one person who passed away in the delivery sector while working or right after working. This means that their working condition is very poor, and they had to keep on working because they were afraid that if they refuse to do this, they will be fired forever. So these were the already embedded precariousness of this area. So they were not appreciated before, while during this COVID-19 pandemic, their need was more more, I would say,
the presence was very necessary.
Exactly.
To ensure basic needs.
So they were more needed.
Right.
And since they were not really protected,
Right.
their working load was actually, their precariousness actually increased.
Now, for a broader understanding of the hardships faced by the labor market amid the pandemic, we turn to the US, where authorities are seeking to better support their essential workers. To take a listen.
The pandemic has drastically impacted our unemployment and our labor market. Right now, unemployment is at about 6% in the US, which is still very high for us. It should be down into the into the lower single digits. We've also seen the pandemic permanently impact the workplace and workplace relations. So America is generally a pretty contentious society to begin with, but I think we've seen heightened workplace contentiousness, more disputes regarding hazard pay and pay time off, and then the more typical harassment and discrimination. We have a resilient economy and labor market, but we haven't seen anything like this since 1918. The pandemic's taken its toll, and I don't see salary disparity or compensation disparity improving over the next few years. Okay, regarding platform workers and the pandemic, here we like to call them, or we typically call them, independent contractors or gig workers, although platform is somewhat used here too. That's been really left to each state and municipality to regulate it. There's not a lot of federal regulation concerning platform or independent contractors. Relative to the regulation of this growing market sector, like I said, our states and cities have been largely regulating this, and that relates to the abuse of overtime payments and the minimum wage standards. So there's also been greater attention paid to physical and psychological abuse among this growing working class. Also, one of the areas that many states and municipalities haven't addressed relative to platform and gig workers is on-the-job injuries. So, generally speaking, in the U.S., if an employee is injured on the job, that's taken care of by what's called workers' compensation. But however, this only applies to employees. This doesn't apply to gig workers and independent contractors. So I think we still need greater consideration given to independent contractors and gig workers relative to work time loss from workplace injury.
Right, obviously this plight is universal. Now, Professor Cho, what are your thoughts on plans here in the country to expand employment insurance to cover all workers in the country?
I think that's certainly a positive move. Just touching briefly upon what the National Assembly is doing to introduce a legislation to protect essential workers, the problem with that bill is that there are essentially preparing for the next major disaster and trying to define, sort of this category of essential workers. But you really sort of do question, where do you draw the line? Are farmers not essential workers? Are the distribution companies of agricultural produce, fishermen, kindergarten teachers, where do you draw the line? And so what's more important is actually having a universal safety net, like expansion of the employment insurance. And so we are going to inevitably face greater flexibility in our jobs, like it or not. And for us all to feel a bit more certainty about preparing for these changes, it's essential, I think, to have this kind of social safety net. If you look at examples like in Germany, Denmark, etc., that is what's really important in protecting workers universally.
Right, and staying with the idea of protecting our workers, Professor Lee, what do authorities here have in the works to ensure a better safety net, as Professor Cho has mentioned?
I, first of all, completely agree with what Professor Cho. I just want to add up a little bit. Korea, together with the United States, is the only two countries that does not have a sickness benefit, sickness allowance in all OECD countries. So people who are afraid, who get ill when they're working and they have an income loss possibility, they don't have any alternative or income protection. So it is being discussed at the moment in the government level, but this has to fasten up because, as Professor Jo said, we need a universal social protection, and specifically social sickness benefit is one of it. And one more is that we need the overall awareness that essential workers are actually doing quite important work in our society, but they have been so much undervalued. And so this has to be done by the civil society, the company, together with the government. And I think this is all partnership that we need.
Right, a public campaign then. All right, Professor Lee, thank you very much for your thoughts today.
Thank you.
Professor Cho, as always, thank you for being with us today.
You.
Right, with the Lunar New Year holiday about a week away, there are concerns about a fresh wave given the persistent cases of sporadic outbreaks. So do seek to abide by prevention measures wherever you are. Thank you for watching.